So today we are going to be discussing about bag and mask ventilation, and for this we require ambu bag. Okay, let me talk a little bit about this. This ambu bag means it is ambulatory, and some call it artificial manual breathing unit, and this is used to give air to the patient. And for this it has various components. This part is known as a self-inflating bag. That means when I press it, it inflates on its own. Next, it has a valve on its mouth end, for which the inspiratory air only goes to the patient and the expired out of the patient is not rebreathed by the patient again. Next, we have an extra valve which lets off excess pressure if we press the ambu bag too hard. Okay, for this we have to select an appropriately sized mask for the size of the patient we have. So this mask should exactly fit the contours of the mouth. So that means it must cover the mouth and the nose of the patient, and it must not be touching the eyes, and it must exactly cover the chin of the patient. So if we use too small of a mask, it will not be properly fit into the patient and the process will not be successful. Okay, so we must attach the appropriately sized mask to the ambu bag, and then I will demonstrate it on the mannequin. Okay, now I will be demonstrating the bag and mask ventilation in this child mannequin. So the proper way to hold this bag and mask is, we must hold the mask by making a C with our fingers. So our index finger and thumb should make a C, and it should hold the mask in position. Next, the three of our fingers should make like an E. So it is like an inverted E. So they must be placed on the chin and below the mandible of the patient. So this is the correct way to hold this bag and mask. So when I press on the self-inflating bag, the chest should expand like this. Thank you. If you can do this on the real exam, you will pass with flying colors.